Yes, sir, I will add it on the screen. Yeah. Good evening, everyone. This is Shreyan from
Okay.
IGCP, today's moderator. I would like to welcome all the viewers who have joined our platform for better exchange of knowledge that is going to be shared by your keynote speaker, Doctor, for today's session. With much pleasure and honor, let me welcome a very renowned doctor, Dr. Narsingh Verma. Sir is the Secretary General in the Department of Physiology at King Georgia Medical University, Lucknow. Now, with the help of Sir and his wonderful insight, we will be taking a close look on today's topic, which is the circadian rhythm in clinical physiology, why timing matters. Now, without any further delay, let me welcome Sir again at our forum and would like to hand over the session to him. Over to you, Sir.
Thank you, and thank you for giving me this opportunity to interact with our fellow colleagues. And today I will be introducing to you a very different topic, chronobiology and chronomedicine. What is that, and how it is important in clinical medicine, and how these concepts can be utilized in for betterment of our patients. So, with this, I start my presentation. You all will agree that everything in our body, every mechanism of our body, every physiological mechanism of our body has a biological rhythm. These rhythms can vary in time, and they can be very small rhythms, even a fraction of second, you can say millisecond. I have shown that, or 1 second, or 1 minute, or few minutes, or can be few hours, or it can be 24 hours. If it is less than 24 hour, this biological rhythm is called as ultradian rhythm. And if it is for 24 hours, this rhythm is labeled as circadian rhythm. And if it is for 7 days, it is called as circaseptan rhythms. And the rhythm which is for 1 year called as circannual rhythms. So with the time, the name can vary, but every physiological process has a rhythm which is called as biological rhythm. इसीलिए ये कहा जाता है कि रिदम है तो लय है. तो जीवन क्या है? लय है. और जब ये रिदम खत्म हो जाती है तो लय प्रलय में बदल जाती है. And everything ends. So every physiological process has a rhythm, and when rhythm is lost, everything is lost. That is why I called it pralay. So circadian rhythm is the most important rhythm which has been studied in detail. And according to this rhythm, every physiological process has a particular time. At that particular time, that mechanism is at peak, and other time it is at its nadir. So the every physiological mechanism has total duration, and in that particular rhythmic duration it has a peak time and a low time. And that is true, and because of that we know that all our activity has a high time and a low time. So everything varies with the time. We can say that at a particular time our concentration is maximum, and at particular time our physical activity is maximum, and at a time our sleep is good, at a particular time our concentration is excellent, and at a particular time our cell division is maximum, and another time another physiological mechanism is its high and peak. How this rhythm has been studied and detailed. The rhythm of the body started with the one particular system which is important, or one particular gland which is very important, that is called as suprachiasmatic nucleus. The suprachiasmatic nucleus is important for creating all this rhythm, and how I will talk. The circadian rhythm term was given by Franz Helberg. and Franz Hellberg was a German scientist working in USA. But the circadian term is from Latin, and the Latin term circa means about, and dies means day. So about the whole day, the rhythm was there, and that is why it's called as circadian rhythm. Before this term used by Franz Hellberg, this was called as diurnal variation. So diurnal variation became the circadian rhythm. The rhythms that fluctuate on a 24-hour time scale are known as circadian rhythm. And physiology are behavioral cycles with a period of 24 hours produced by the each endogenously is called as the circadian rhythm, and it is produced by pacemaker. Franz Hellberg, who coined this term circadian, is widely considered as father of the medical chronobiology. And basically, he was working in America, so American chronobiology, you can say. The best known circadian rhythms which have been studied in detail are body temperature. We know that it is a rhythm, and hormonal secretions, and the metabolism or metabolic activities, and the sleep wake cycle. Sleep wake cycle. How this external time and internal clocks can be correlated or can be adjusted according to time. We know that external rhythm, a 24-hour rhythm, is because of the rotation of the earth, and earth is also taking a round of the sun. So this light, which is in daytime, coming to the eye, and from eye, from the retina, it goes to the brain, and in brain, it basically goes to suprachiasmatic nucleus. And there are tracts similar to rods. There are rods which receive this uh, photo you can say reception, and that goes via tract to the suprachiasmatic nucleus. Suprachiasmatic nucleus has around 2000 neurons, and these neurons are receiving the this stimulus, and whatever stimulus they have received in the form of light, on that basis suprachiasmatic nucleus has a clock system. There are clock genes. On the basis of that, they produce different type of effects, and via hormones, via neurons, via enzymatic system, they affect the pineal gland to produce melatonin. And melatonin and other hormones by other endocrine glands, they make a circadian pattern which we can call as circadian rhythm. So basically, the changes are occurring on the basis of light and dark, activity and rest, and the social time, and the various cues. Cues are the external stimuli which can change our circadian clock. So we know that there are circadian clocks, basically two types, one at central level at suprachiasmatic nucleus, and the peripheral level. At peripheral level, every cell, every system has a clock that is called as peripheral clock. And normally what is happening, that the central clock is regulating the peripheral clock, and peripheral clocks are following the commands from the central clock. And the central and peripheral both clocks are affected by a lot of external stimuli, which in our terminology are called as QCUE. And the Q can be light, it can be sleep, it can be environmental changes, it can be temperature, it can be the food, and it can be the sleep. So all these things can change our the external, our central and peripheral clock. So on the basis of that, this clock system develops. So what I was talking, that the central clock is basically suprachiasmatic nucleus, and this is called as SCN, and there are 20,000 neurons approximately which are there to receive the light stimuli, and they form the basis of this particular rhythm. So basically, circadian axis is in mammals can be divided into three distinct functional components. One, a master pacemaker situated in the suprachiasmatic nucleus. Second, a photoreceptive input to the SCN that originates in the eye. And third, the married of rhythm, the rhythmic outputs that provide insight into the clockwork of the circadian pacemaker. So that is how the axis is formed. This is the retinal connections with the SCN, and the retina receives the light, and by retina the similar structure to rods are there which receive the light, and by the neural connection it reaches to SCN nucleus. And the this clock regulation is via the known genes. Now we know a lot of genes have been identified, and they are basically regulating the clock. And the basically by that a lot of hormonal changes are occurring, and these hormonal systems do have a rhythm. Some important hormones are listed here. They can be the VIP, the glutamate, and others. They form the cellular circadian clocks, and they give the basis for neuronal peripheral organs. And at the peripheral organs, these neurotransmitters, hormones, and they regulate the various functions of the body. But not only that, the peripheral clocks do follow the central clock, but they have the impact on the central clock as well, and that is why the rhythm can be changed by both the sides. So normally what is happening, that the circadian regulation of the central and peripheral clock in various organ system, especially in mammals, is that the central clock receives light, and on that basis that clock is operating, and the same mechanism goes into the peripheral clocks, and these peripheral clocks are found in almost every organ except the germinal epithelium. They are present everywhere, and you can see normally the central and peripheral clocks are in a rhythm. We called is the rhythm, and that rhythm is basically present, and this is called as, you can say that the central clock commands are being followed by the peripheral clocks. And in a healthy condition this is happening, but due to the social demands and so many other factors, the when the normal pattern is disturbed, this is called as dysregulation of the clock, and that dysregulation is the basis of various disease. This is called as circadian desynchrony. Whatever I described was synchronization or synchrony, but synchrony is lost when, because of the demand of social demands and behavioral demands, we take out the action at wrong time, and then we do not honor the time, and that causes circadian desynchrony. Now the peripheral clocks are not following the central commands. They have their own rhythm, and that is circadian desynchrony. And we chronobiologists believe that this circadian desynchrony between and among the SCN and the various oscillators in peripheral tissues result in circadian associated melodies. And some examples are given here: travel across multiple zones, which is termed as jet lag, and shift work, and the so-called modern lifestyle, the most common causes of circadian desynchrony. For example, Normally, what is happening during night time, the hormones have different secretion level, and enzymes do have different secretion level. And normally, insulin is not secreted during night time, only basal secretion continues. But if somebody takes meal at 11 p.m., then what will happen? The insulin had to be secreted. And now the peripheral clock of insulin is not following the central command of the SCN nucleus. And now the insulin is being secreted at the wrong time. This is desynchrony, and that will, in long run, will produce diabetes mellitus. So we chronobiologists believe that time is most important, and the desynchrony is the most important factor for causation of various disease. And the life evoked with 24-hour rotation of the earth. As a result, the organisms have evolved ways to measure the daily time, and on the basis of that their circadian clocks are regulated. But many changes in physical, mental, and behavioral state are governed by endogenous circadian clocks, and that leads to a result of disruption of these clocks, which can because by the misalignment between the environment and the internal clocks, or dyssynchrony of the clocks within the organism, can have pathological consideration and consequences, and they are responsible for development of various diseases like diabetes mellitus, thyroid disorder, hypertension, and many other diseases which are related with deregulation or dysregulation or desynchrony of the circadian clock. This is the evidence from the internal desynchrony caused by the circadian clock resetting, and we have a lot of literature available. And the comment is that circadian desynchrony occurs when endogenous rhythms become misaligned with the daily uh, photoperiodic cycles, and this condition is facilitated by artificial lighting. Today we know lot of artificial lighting is there. Normally, what is happening? When the light goes dim, I'm talking about sunlight at 5 6 p.m., it goes dim, then our pineal gland starts secreting melatonin in very slow manner. Slow release of melatonin occurs at dim light. But nowadays, what is happening? The light never goes dim. When the artificial light is dim, when the sunlight is dim, we create artificial light. And now what is happening? That normally melatonin secretion should start at 5 6 7 p.m., but now because of the artificial light it is not starting, and melatonin secretion does not start at 5 6 p.m., it starts at 10 11 p.m. when a person dims the light. That is why sleep disturbances and lot of sleep disorders are occurring in our population. So I have shown here the healthy clock and a disrupted clock. You can very well see that a healthy clock has everything aligned, everything is in time, and a disrupted clock is a disaligned clock, and lot of inflammatory markers, inflammatory condition, metabolic misalignment, all these are occurring in a disrupted clock. And this disrupted clock is responsible for most of the metabolic diseases. So basic metabolic regulators which are there, which regulate everything, the circadian clock components along with the nutrient sensing pathways uh, prevent the metabolic disease through the interaction of the types of basic metabolic regulators. Normally, what is happening? The metabolic disease do not occur because these regulators are interacting, and they regulate everything again to the back. and these regulators have been identified, and they are the endocrine hormones. Endocrine hormones has a basic rhythm. They are secreted in rhythm. For example, growth hormone is secreted during night time, during sleep time, and when there is dark. And secretion of growth hormone is also regulated by the darkness, sleep pattern, and physical activity and starvation. These four things are important for the secretion of growth hormone. And growth hormone has its own pattern, secreted more during night time and during sleep time. That is why when a child is born, he is having around 18 hours sleep, because more growth hormone is required, and growth hormone is being secreted during night time. But when a child is growing, then only 12 hours sleep is there, and 12-hour sleep is enough to produce the growth hormone. But in the adult and in a geriatric population, what is happening, that the sleep goes further decreased, and growth hormone secretion is dented, and hardly any growth hormone is secreted, and this growth hormone secretion goes down. And finally, what is happening, that now the growth hormone secretion is very less, and that causes the geriatric age or more maturity. And we know that the growth hormone is important, and that is required to maintain us young. Similarly, other examples can be given. So factors affecting the circadian rhythm are the food. Food, if not taken in particular time, normal time for food intake is daytime, not the night time. Because during daytime, a lot of enzymes are secreted in the GI tract, and GI motility is different, and salivary secretions are different. But during night time, hardly any enzymes are synthesized and secreted. But if somebody takes meal during night time, now the glands have to secrete enzymes, and they have to secrete hormones, and this causes misalignment or desynchrony, and that is responsible for a lot of metabolic diseases, including diabetes, thyroid disorder, hypertension, and even the liver disorders, fatty liver, etc. And they all are because of the food taken at a wrong time. So, regarding to the latest research related to food, we can say it may be important what we eat. It is also important how much we eat, but most important is at what time we eat. So, time is very important. Similarly, the GIPH also keeps on varying 24 hours. During night time, it does not favor for the absorption and digestion. So during night time, one should not take meal. And other factors are there, like the intestinal motility, the intestinal blood flow, the light. Light is also affecting everything. And light has been used as a therapy to regulate a lot of disorders. Even the psychiatric disorders, light therapy has been used. If somebody wants to advance its circadian pattern, then one can use bright light during the morning time, and that makes a person to rise early. And similarly, very dim light in the evening makes a person to go to sleep early, and that can change the circadian rhythm of that particular person. So light is important, the timing of exposure to light is important, and the the other important factors which regulate the circadian rhythm I have shown here. Some of the less attended factors are, at present, what is happening, why most of us are having disrupted clocks or deregulation of circadian rhythm, because the food intake at present is maximum, but the quality of the food has gone down. Quantity has increased, but the quality has gone down, and the decreased physical activity. And physical activity regulates the circadian clock. If the physical activity is less, and then the everything will change. And voluntary sleep curtailment. Voluntarily, we are not going to sleep, that is making a lot of difference. And artificial light, bright light, red light, or even blue light. Blue light is most important. If you talk about blue light, you must remember Vibgyor of our Indradhanush and rainbow, and that is why the blue light is more dangerous. And blue light is by the computer, by the our gadgets and the smartphone, television, etc. So if somebody is using phones and the television with blue light, computer, etc., during late hours in the night, that is going to disrupt his sleep. Other thing can be important here, the night shift work. I know that night shift work was required, but somebody if want to work during night time, the night shift work had to have different shifts for different persons. One cannot be asked to do night every for whole month or whole very long time. If the shifts are being changed, then the harm by the shift work is less rather than in the same shift. We know that we cannot avoid shift work, but we can regulate these shift very well. Stress again can change the circadian rhythm, and there are a lot of papers which support it. And the environmental factors, especially, I will mention here the particles which we cannot see. These small particles, they are very important, and they can regulate our rhythm as well. This is the I have shown the circadian rhythm and severity of the clinical disease. Now we know with the work of Michael Stronovsky. Michael Stronovsky is a great scientist, a Russian scientist working in the circadian rhythm. And I am fortunate that I have worked with him for some time, and he invited me to work in his lab. But due to my clinical engagements, it was not possible. But he has created this particular slide that shows that all the symptoms have a circadian rhythm. The gout attacks C at a particular time. Other diseases and symptoms have a particular time. So I can show you here this particular slide that you will find that worst of time. Every symptom get worse at a particular time. And if you include this in your history taking, then you can differentiate diseases from very beginning. You can find out that a particular symptom, asthma attack, gallbladder pain, or other things have a particular time. So by that you can diagnose them better, and even make confirming the diagnosis. You can have a broad diagnosis in your mind on the basis of this worst of time. Circadian application of the concepts of chronobiology. So the practical application of the concepts of chronobiology is on so many things, even from history taking to clinical examination to investigation to diagnosis, we can use them. The dietary composition and calorie levels are key factors affecting the aging and age related diseases. So, dietary restriction of various times has been found to promote the metabolic and cellular changes that affect the the oxidative damage and inflammation, optimizing energy metabolism and enhancing the cellular protection. So, different grade of dietary restriction have been suggested. They are included in a great terminology of intermittent fasting, and that intermittent fasting can vary from pattern, and one can have different patterns, and it is also one type is called as the the time restricted meal, TRM. A particular time the person is taking meal, for example, nothing after 7 p.m. So if the liver gets relief of around 12, 14, 15 hours during night time, then most of diseases can be cured and can be prevented, and we can reduce the burden of diabetes, thyroid disorder, osteoarthritis, fatty liver, and so many hypertension, prehypertension, coronary artery disease, heart failure by including this particular knowledge. So we know, you see here that how hormone melatonin and cortisol, two hormones I have shown during the daytime, during the night time, how they are changing They have a circadian pattern and they have interaction, and on the basis of that, one can have the particular circadian rhythm. This is the rhythm of life. One can have a particular symptom, particular mechanism very good at once a time and can be bad on another time. So circadian synchrony is wakefulness and good sleep, and the feeding is at time, fasting is there, nighttime fasting, and the energy storage is there, and energy utilization is also there. This has a synchrony. And circadian desynchrony has the sleep as wrong time, circadian disruption is there, and that is leading to metabolic phenotypes and the behavioral, clinical, and the molecular changes can be at the worst, and we can have a lot of diseases. So, what is chronomedicine? The term chronomedicine may be conceptualized as dealing with the prevention, causation, diagnosis, and treatment of disease in humans with a particular focus on the role of time. So, the time plays in our physiology, endocrinology, metabolism, and behavior of many organizational levels. One who studied all this is called as a person specialist in chronomedicine. So the heart of it is old concept. This is very old concept, chronomedicine, but recently it has been especially uh, called as, and clinical chronobiology can be there, clinical chronomedicine can be there, preventive chronobiology or chronomedicine can be there, and chronotherapeutics. It has also been used when time is considered for therapeutic considerations, a particular time of giving a drug, and drug delivery system can change, and the drug can have the maximum impact at a particular time. That is called as chronopharmacology or chronotherapeutics. And the relation to disease, the delicate balance to the cycling of enzymes, metabolites, cofactors, and immune regulators is essential to achieve cellular homeostasis. Disruption of the circadian homeostasis has been linked with the development and progression of lot of diseases, including even cancer. Medicine's secret ingredient is the timing. It has been neglected for a very, very long time, but today we know 80% of the drug act on target that oscillates over the course of the day. So at a particular time, drug will have more action, and if you know that, why not the drug should be given at that particular time? Why unnecessary we are burdening the cells when we know that the receptors will be active at a particular time? And how to choose and the right circadian medicine approach. Again, this requires a lot of circadian knowledge and to know the chronotype of a particular person. And by knowing that, we can use a particular drug at a particular time and concentration, and that will minimize the side effects and will have more impact on the disease treatment. So the new concepts are the homeostasis is state that the physiological variables oscillate and are adjusted only to a narrow physiological range throughout the day, which is essential for health and all organs and tissues of the body perform the functions to maintain these conditions. So this is important that these considerations should be kept in mind. Since the early 1990s, we have shaped our medical practice in various ways, such as with the evidence-based medicine, translational medicine, the narrative uh, medicine. Now there is an emerging subset of the personalized and the precision medicine. And this precision approach is possible only by knowing the precision mechanisms on a particular person at a particular time. So this is very, very important. 2017 Nobel Prize was given to the scientists which are working for these clock genes, which now we know because of their efforts. And this 2017 Nobel Prize was given to these three individuals, and they were working in the field of chronobiology. Future implications can be in the form of the knowing the complex cellular rhythmic process in the timing of medication, administration of uh, the these uh, the the drugs which can change the timing of action as well. Already, administration of the certain chemotherapies is organized around the lifeline timeline and the recognized the potential interaction of the medication with liver enzymes and other circadian control. There are some indications that the examples of some inflammatory and autoimmune diseases respond well to the appropriately timed treatment. So now we know that a lot of evidence are occurring in this field as well. So with this, I will like to end here, and I will invite your questions, and that will be more useful rather than if you keep on talking on the circadian rhythm for a very long time. So with this, I invite your questions.
Thank you so much, sir, for this wonderful presentation. We do have some question if you like to take that up.
Yes, 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 yes.
So, sir, the first question is, hello. So, am I audible?
Yeah, yeah. You are audible.
Yeah, yeah. Okay. So, sir, I was asking you the first question, which is
Yes.
how does the uh, circadian rhythm influence hormone secretion and metabolic process in clinical setting?
I told that the every hormone has its own rhythm. For example, melatonin secretion starts when the light becomes dim in the evening time and get its peak around 10 p.m. And because of that, we have our peak of sleep during night time. Cortisol hormone starts at the time in the early morning and gets peak in the early morning. After that, it gets peak around 10 a.m. and by that, the declining occurs. So every hormone had its peak, and these hormonal regulations are the basis of the circadian rhythm. So normally they have a particular rhythm, but our body activities, our physical activities, our social engagements, and our wrong timing meals can change their rhythm, and that causes deregulation.
Thank you, sir. Next up, we have what are the implications of circadian disruption on sleep disorder and overall health outcome?
A very good question. The most important physiological mechanism which has been hampered nowadays is sleep. और मैं यूजुअली कहता हूं कि मेरा भारत पिछले 50 सालों से सोया नहीं है. कोई उससे सुला दे, जैसे ही सोएगा बहुत सी बीमारियां ठीक हो जाएंगी. क्यों नहीं सोया है? क्योंकि मैंने बताया एट द इवनिंग टाइम व्हेन नेचुरल लाइट गोस डिम, the smart the secretion of melatonin starts at very slow rate. But nowadays there is no dim light. जैसे शाम को लाइट कम होती है सूरज की, हम बल्ब जला देते हैं, रोशनी कर देते हैं, पूरी रात रोशनी रहती है. And because of that, our sleep is affecting, and the quality of sleep has gone down. The computers, other gadgets, smartphones, all they have decreased our sleep quality and time of sleep. And that is creating a lot of sleep disorders. And worsening of the diabetes, worsening of the hypertension, worsening of the CAT, and worsening of the so many other diseases. So sleep is most important aspect which is being neglected nowadays, and we clinicians must educate our patients about sleep hygiene, and we also honor that the sleep hygiene.
So there is one last question. How do modern lifestyle and shift work affect circadian rhythm and their clinical implications?
I have shown in my presentation that beyond doubt, studies have shown that shift work is responsible for development of new onset diabetes, hypertension, sleep disorders, thyroid disorders, and other metabolic diseases. But we cannot deny shift work. It is the need of hour. So what we have found in our studies, basically in my laboratory, we have so many research on that, and we have found that if the shift work is rotating shift, then the effect can be minimized. So need of hour is that employers should rotate shift of the employees, not asking the same person to do the night shift. They can ask in the rotating of shift, some daytime, nighttime, mixed time. So if they keep on rotating, then our circadian rhythm is least affected. And all these disorders which are from the jet lag or from the shift disorders, shift work, they can be treated by using a particular salt which is very important. One is melatonin.
Thank you so much, sir, for answering all our questions. That's all from our audience, sir. Before concluding, any take home message from your end?
My take home message is that we clinicians must think in that particular direction of time, and we should include in our history the history of time, at what time the patient is going to sleep, at what time he's eating, at what time he's going to exercise, and what time he's using the gadgets. So this should be included in our history, and we should honor that the particular examination should be done at a particular time. For example, if you want to take the pressure of your eyes for glaucoma, it should be done in the early time, in the early morning, not in the late evening, because in the late evening you may miss the glaucoma. It should be done early in the morning time. Similarly, lot of tests like the spirometry, it has a variation in the morning and evening. So one should know that, and all other investigation, we must follow the time. We cannot take sample at any time. So we should practice chronomedicine. We should honor the chronobiology principles, and we can educate our patient to honor these natural cycles.
Thank you so much, sir. It was a wonderful session, and it's a pleasure to have you here with us, sir. Thank you so much for joining us today.
But
Thank
I
you.
am sorry, today I was a little bit shaky because my eyes were dilated and I was not able to see anything. But anyhow, I made it. Thank you.
No, no, sir. It was wonderful. Thank you so much.
Thank you. Thank you. Thank you. Thank you.